Welcome to Adapt Medical Education Fertility Topics. Our innovative approach provides a next-generation online learning platform featuring adaptive learning technology, one that teaches your patients about infertility via high-quality videos, ebooks, and interactives. Our technology has been proven via our university program. We've delivered online courses to thousands of college students. Our patent-pending adaptive learning platform will ensure your patients truly understand fertility topics, and you will be able to track their understanding. We offer state-of-the-art patient support via an online private social network for your clinic, as well as a built-in referral network to help build your business. I will cover each of these in more detail throughout this presentation. We understand not every patient is the same. They all learn differently and at different speeds. For every topic we cover, we offer video, ebook, and multimedia interactives. We call these modalities, and they are different ways to learn, allowing each patient to learn in a way that's best for them. Also, some patients may absorb new material very quickly, while others may need to repeat some topics. Our courses automatically adjust, either slowing down and simplifying the materials, or speeding up to cover content quickly. This is proven to increase patient engagement and understanding of the course materials. Our videos allow patients to learn about procedures by viewing precise and accurate 3D animations. This is beneficial for 3 reasons. It helps prepare them for their appointments, saves you time in explaining key elements of infertility, and gives the patient a better experience by reducing their anxiety. Patients have told us the more they understand, the better they feel about the care they are receiving. And our doctors love that patients come to their appointments with some basic understanding of fertility and procedures. Here's an example of one of our animated 3D videos. This is a blastocyst traveling through the fallopian tube being helped along by cilia. If you look at the top right, you will notice it says watch, read, and practice. Those are the 3 modalities I mentioned earlier, and patients can easily switch between them. In this example, you can see the blastocyst is hatching and preparing to invade the wall of the uterus. Because we know some people learn better by reading, we've developed excellent ebooks for each subject. Here's an example. Please notice each picture has a definition above, key graphics are included, and everything covered in the video is also covered in the ebook. Here's an example of one of our multimedia interactives, designed by experts in game mechanics. Notice the phrases in orange. The patient pulls them to the correct gray box on the right. If they get it correct on the first try, they will see the progress in the mastery meter. If they get it incorrect, the course will offer hints to encourage the correct answer. This gives immediate feedback to keep the patient engaged and moving forward. Here's the completed multimedia interactive example featured on the last page. Notice the mastery meter has gone up because the patient got it correct on the first try. In the bottom, you will see instant feedback, letting the patient know they answered correctly, along with an interesting fact about fertility. Our platform was specifically developed to keep patients engaged by adapting to their pace and mode of learning. Whether they prefer videos or reading, we have technically accurate information for them to learn, and our interactives ensure they know and understand the topics. We also allow you to track each patient's progress and patterns. For example, you can see if they watched a video, read the ebook, and you can also track their progress against each topic. Here are some testimonials. The meeting with the patient was much more productive with time spent addressing more specific questions or concerns regarding IVF treatment. I felt the patient was more at ease with the treatment plan after using the portal and felt more comfortable about the treatment plan. Dr. Saeed Adonishment. We found the fertility education portal to be very helpful and straightforward. It provided the perfect amount of information without overwhelming us. Not only does the portal provide the information that answered many of our questions, we liked that we could learn via video or ebook. Mike and Katie. Here's an example of the reporting summary. As you can see, there are a number of patient metrics. For example, total number of topics completed, last time they logged into the system, time spent in the system the last 30 days, just to name a few. Another key benefit of our platform is our proprietary private social network. This network carries your clinic's brand and allows your patients to share their experiences with one another. In our market research, patients said they get comfort when sharing their experiences with other patients going through similar circumstances. They also have the ability to privately ask their doctor any questions they may have in a secure online environment, and you have the ability to send them information in a secure environment. For example, lab results. Here's an example of a support group. This one is called Baby Struggles. Please note this is branded as your clinic. If you look at the members on the left, Baby on Board, Want Kids, and Want to Be Mom, you will notice there are no pictures. That's to protect the patient's privacy. However, the doctor and staff will be able to see each patient's entire profile. Here's an example of a profile. This one belongs to Rachel Clark. If you notice in the body where it says screen name, hers is Parenthood. When communicating with other patients, that's all they will see. If you look at the button on the top right, it says Make a Referral. I will cover this important button next. We understand a referral is the ultimate thank you from a patient and something that helps increase your patient roster. Using our platform, a patient can refer to you another potential patient, and you will be informed upon this referral. Coming soon, doctors will be able to refer patients to other specialties. This is an example of a patient flowchart. Now we understand not all clinics operate the same way, so we can certainly customize one for you. In this example, the patient is interested or referred, contact is made, the clinic will get personal information such as email, phone, etc., and then schedules an initial appointment. We recommend the patient be given access to the portal now and asked to complete the Getting Started and the Intro to Fertility videos before the initial appointment. When the patient comes to their appointment, they will be more informed and prepared, resulting in a more efficient and productive initial appointment for everyone while increasing patient retention. Then they would meet with a new patient coordinator, review the welcome packet showing all diagnostic testing needed. Once they schedule their testing, have the patient complete the sonohistogram video. Once they proceed with all necessary testing, labs, cultures, etc., they can meet with a wellness coordinator or nutritionist. Once the tests are complete, they will meet with the doctor to review next steps. At this point, if IVF is recommended, have them review the IVF video. Please keep in mind they've had access to the support group feature through this entire process. Here are some of our current offerings, as well as some of our new patient education courses coming soon. Thank you for taking the time to get to know Adapt Medical Education. If you'd like more information, please email info@adaptmeded.com.